Let's go through the physiology question quickly. I do not have the options of some questions, right? You can give me in the chat box. I'll definitely add them up. So first question, I was very happy that there were many, graphical questions came, and it was from our notes, right? So I hope you can see the slides. All right. So let's move on. This was the question, right? And I want to know there were two scenarios I got that ABCD was shown, and they have asked which valve is going to open at this point, right? And I got another question like this, that X point was shown, and they have asked, oh, what is going to happen? So let me know. Acha, ABCD option was given. All right, the options were ABCD, and they have asked that aortic valve opens where? Okay, I'll change that. But you know that this point was shown, and aortic valve is going to open at the right hand side uppermost point, right? Our mnemonic is going to work over there, ma'am Coco, right? Next question. Next question, Rio-based chronicity and utilization time. Usually this is not asked in the FMG, but it is again a repeat PYQ from the I9CT question banks, right? So see over here. First thing first, whenever you give a threshold stimulus, I told you the threshold stimulus is going to be called as a Rio base. So threshold stimulus will be called as a Rio base. So this is A is the threshold stimulus, right? Over here, the strength of the stimulus is given. So threshold stimulus is Rio base. Then they have asked this one, right? When you give threshold stimulus, the time required, the duration required to give the response is known as utilization time. Utilization time, mind you, it is not when I give double the Rio base. It is only when I give the threshold stimulus, it is known as utilization time. And when I increase the Rio base, that is double the Rio base stimulus is given, the time required is going to be chronic C. That is going to be there. Okay. Yes, and I repeat question. Koi baat nahi. All right. So this was the question. I hope it is right. This is how it is given. Yes. Let me know that. Okay. Chalo. Next. ये वाला question आया था ना. I hope that all the cerebellum students got it correct, because the bridge is ready for you otherwise, right? I hope you got this correct. I told you whenever there is a head trauma and increase intracranial tension, there is a confusion between the heart rate and BP, but I told you heart rate is only going to increase in the vein bridge wala reflex, right? So that's why over here you have the bradycardia and hypertension. That is nothing but what? That is nothing but the Cushing's reflex, right? Confusion wala reflex, right? I hope this is correct, है ना? So जिसका भी wrong हुआ है, so let's go on the bridge, right? Let's leave you on the bridge. Next question, a typical pattern, ये तो हमने 1000 बार किया हुआ है. This has come in the marathon also. So crescendo, decrescendo pattern or diamonds are shown over here. So chain of the diamonds. I told you chain of the diamond is shown. Then it is chain stroke breathing or kind stroke breathing. All right. So that is going to be there. Okay. Fine. Right. So that is there. I hope that was correct. And one pregnant female was given with the iron deficiency anemia, and she is already taking the iron folic acid tablets. But for increased reabsorption, you say, or efficiency of the treatment, the clinician has given one more vitamin. The vitamin C is going to be the answer. Why? Because vitamin C increases. Yes. Vitamin C increases the iron reabsorption, right? This was the question. I hope it was there. Okay. Next. This was the question. I hope this is what I have got. Lowest sodium potassium conductance, where it is going to occur in the action potential ka point that they have shown. So I'm going to mark the hyperpolarization because they have asked lowest sodium potassium conductance. And I told you, if I take sodium is to potassium conductance, right, and I want it to be lowest, I want least sodium conductance. That means the sodium channel must be closed and the potassium is still going outside. Right, so it is going to be at 0.4. Why not at repolarization? Because in the repolarization the sodium is inactivated, they're not closed per se, right? So only potassium is going to go out, which is going to give this fourth point. So if I have to choose, I'm going to choose the fourth point, right? So that is going to be there. Okay, ratio was asked, so you have to give me the ratio. कैसे पूछ सकते हैं यार? रेशो में क्या पूछा था? लीस्ट रेशो पूछा था। ठीक है, इवन ऑलराइट, BCEF was the option. Neeraj, BCEF, ABCD was there in this options. 1, 2, 3, 4 की जगह ABCD होगा. Ratio was asked. Okay, चलो, I'll change this question. टिप पे था, क्या पूछा था? They have marked the spike potential. Is it like that? Okay, let me know what was the question. Geeta Gyan, please let me know whether they mark the spike potential and then they have asked. Okay, just give me the inputs. I'm definitely going to check the chat box. Okay. Next, botulinum toxin mechanism of action. This was the question which was asked. Conductance ratio is going to be highest. Okay. Highest value. Chalo, I'm taking the screenshot and whatever it is there, I'll just mark it up. All right. I'll change the question accordingly. Now, this was the question asked. Botulinum toxin, ये question था, right? Same graph दिया हुआ था. Okay. चलो, ठीक है. Where the potassium channel closes. It is going to be after the hyperpolarization. Chalo, ठीक है. Let's move on. Just give me the inputs. I'll definitely check the inputs afterwards. Presynaptic blockage. Synaptobrevin is going to be attacked, right? And the acetylcholine ka exocytosis will be blocked. Okay. Pufferfish was mentioned where? Uh, it is Zaza Zaza 122, right? So pufferfish was mentioned where? In the question it was mentioned. Okay. Yes, tetrodotoxin. So options were correct. Option, they have asked the mechanism of action, right? Yes. What was the question exactly? Let me know the options, right? And the question. Chalo. Next question. Patient had a head injury, can talk fluently, but does not understand. I told you, well spoken is Wernicke's. Well spoken, बात अच्छे से कर रहा है, but does not understand means nonsense aphasia or sensory aphasia. One person told me that Wernicke's was given. One told me that area has been asked. Let me know which one was asked. Area was asked, or the aphasia ka naam, the name of the aphasia were asked. Which one was the correct scenario over here? Let me know whether the mechanism of action of what? Tetrodotoxin is mentioned. Okay. All right. Badly prepares pufferfish. All right. Chalo. Okay, comparison of the toxins. Acha. Botulinum is going to attack the snare proteins and tetrodotoxin is going to block the channel, right? All right. Aphasia is asked. Chalo. So I'm going to cut this down. So aphasia was asked, not the areas, right? Chalo. Next. हाई एल्टीट्यूड पे माउंटेन सिकनेस हो रहा है नॉन स्पेसिफिक सिम्टम्स के साथ हेडेक नाउजिया डिजीनेस फटीग एंड हाइपोक्सिया SpO2 लो SpO2 was mentioned. What is the best treatment? Given the scenario of acetazolamide, the best is going to be descent to the lower altitudes. I'm going to mark lower altitude is going to be the better one as compared to the acetazolamide. Let me know, somebody has told me that there was a question related to Laplace law. Was there any question related to Laplace law and what were the options? Please let me know about it. Meaningless patient. Okay. Done. Decrease heart rate, increase. The ICT question was done better. It was just done. All right. Next question. Pregnant female in the third trimester. I got to know that there were 3 to 4 questions are related to ABG, arterial blood gas analysis, right? But I haven't gotten this. Plasticity graph. All right. Plasticity का कौन सा graph आया था बेटा? You're talking about the urinary bladder का cystometrogram, right? Cystometrogram was given. Is it? Plasticity is due to, okay, I'll just add there. Plasticity is due to, okay, so this was also a graph based question, right? Graph was given, yes? Or just they have asked that plasticity is due to? Let me know, okay? Chalo. Next, identify the mechanism. Pregnant female में third trimester में progesterone is going to be very, very high, which actually stimulates your respiratory centers. If the respiratory center is stimulated, of course, the hypoventilation is not going to occur, right? Hyperventilation is going to occur. And hyperventilation से क्या होता है? The CO2 is going to wash out. And that's why I'm going to choose the respiratory alkalosis. There is no problem in the kidneys per se. All right? Okay. Vishnu Prashant, kindly let me know if you know what are the, basis of those four ABG questions. Graph was given. Okay. Thank you, Pavan. I'll just add those graphs. Okay. So typical question of the systematogram, which we have discussed in the classes, right? Next question, I got to know that there was this acidosis was given, pH was low, and the exact value of PCO2 and bicarbonate I haven't gotten yet, right? But they told me, students told me that there were low PCO2 as well as a low bicarbonate. Bicarbonate is low, acidosis meeting the criteria, right? That means there is a problem in the metabolic system, right? And of course, I told you, always look at the pH first. So it is the case of acidosis, not alkalosis. So two options were out already. Metabolic acidosis because the bicarbonate is low. The PCO2 has been low, but the acid is lower, but pH is also lower. That means it is going contrast to the pH change, and that means it is compensating, right? So that is all I have gotten till now, right? And I'm taking the question. Transduction का क्या question था बेटा? Transduction का क्या question था? Let me know. Was it related to the receptors, somatosensory receptors? Is it CNS से? Pacinian corpuscle, mesial corpuscle. Sneha, let me know, was it related to the somatosensory receptors? Three questions on the ABG. Third question, can you give me an idea that what kind of question has been asked? Paradox, Oxy paradox. Chalo, you give me the idea about it, right? Definitely what I'm going to do is I'm going to take your inputs and I'm going to make a proper PPT and we'll share it on the Cerebellum app, right? Till that time, I'll hand over to the next faculty. That is all from my side. Thank you very much.